Hi there, I'm Amanda Mattice, your Hekman librarian for nursing. If you're new to using the library resources for nursing research, this video will review some strategies and things to keep in mind as you get started searching. First of all, I do recommend checking out my Nursing Research for Beginners guide, which goes over how to find nursing databases and how to get library help anytime. It also has our library research module, a few slides to walk through important searching strategies, such as putting together a good PICO question. Now, you'll talk about the PICO model plenty in class, but as a reminder, this acronym is what we use to structure our research questions, helping us identify the most important parts of the issue we want to study: population, intervention, control comparison, and outcome. So, for example, if I'm interested in the problem of weight management for adults with diabetes and the potential benefits of a particular diet, my PICO question might look something like this. For diabetic adult patients, is the ketogenic diet effective for healthy weight loss? Here's your first tip at this stage of your research planning. Always consider the possibilities for making your PICO more focused and more flexible. Think about it. In my questions so far, I could be more specific and choose a particular age, gender, ethnicity, or other factors for my patient population. On the flip side, I could also be more flexible and change my outcome to weight maintenance to avoid limiting my definition of healthy to just weight loss. Now let's think about how to translate this into a database search. We know what we're looking for, we just need to pick the most effective terms to describe that. Here's a tip that's especially helpful if you're just beginning to learn about a topic. Start with broad ideas and pick up more focused terms by exploring your search results. Eventually, you do want to find sources that fit your PICO question more closely, but it's okay to experiment and learn more first. Here's another way you can pick up more potential search terms. Use the database's keyword suggestions. Here in the CINAHL database, if I start typing out some part of my search like ketogenic diet, you can see that the database starts to guess what I want and offer alternatives. This string here with ketogenic diet or keto diet or ketosis, blah, 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 could be a useful way for me to find results that are similar in topic, but maybe using slightly different terms. Notice how there are ors in between all of these keyword suggestions? That way, the database knows these are all optional. You can actually type a complex search this way for yourself if you want to. See the little drop-down menus in your advanced search here? This will combine your terms either with or and. So my complex search could look like this. You might be wondering, where did some of the other words in my PICO question go, like patience or effective? It's not always necessary to include every word from your original question, as long as you're describing and summing up the essentials that you want to find. Remember, databases are just looking for the appearance of your search terms anywhere in their article titles or descriptions. So those little words or words that are exceptionally commonplace won't help you focus your results. After all, pretty much every study is going to have the words patience and effective and the. So there's not much point in including them in my search. So there's plenty more that I could talk about when it comes to searching strategies, but here's my final tip for this video. Give yourself time to keep going and trust the process. Searching can take quite a while sometimes because we're often figuring things out as we go. That's actually totally normal, so don't give up if you don't find what you're looking for right away. If you can practice persistence and patience in the face of research challenges, you'll develop research resilience that will really serve you well in the long run. And of course, you're not alone. You've got a whole community here ready to support you, including me, so feel free to message me anytime you have research questions or concerns. Until next time.